we've asked Dr. Larry Lambertson to be our presenter of cases to Dr. Hora. Larry is a psychiatrist in private practice in, is it Irvine or Newport Beach?
Irvine.
Irvine. Oivine. And he has many of these issues to deal with, so we've asked him to present some cases to Dr. Hora for his discussion. Larry?
Well, earlier Dr. Hora said that we gain freedom through the process of knowing the truth. And I still find myself very much in that process without having access to total truth when the need demands itself at times. So I think that the cases I will present, as well as the questions, are a reflection of that, and I hope that we can all benefit from trying to understand more what to do in those situations, how to be. First case I'm going to talk about is a 29-year-old male. I use initials for purposes of confidentiality, call him JL, who I have been seeing.
That's what we're saying. Nine folks. I said he ain't 29. Come on, kid.
JL has been seeing me about once a week for most of the past year. Recently, about a month ago, he was coming to see me, not having seen me over the holidays for about a month. And in a session with me, proceeded to talk about how he recognized that he was depressed again, life was never going to get any better. He knew that it wasn't worth going on, and he had almost not come to the session. He had come early. I had been free 15 minutes early and had seen him walking to his car and said, not knowing he's walking to his car, told him I could meet with him early. This was at a hospital where he met me. He came in, and knowing that if he said he was suicidal, I would have grounds to hospitalize him, he intentionally guarded his statements and would not talk about suicidal thoughts or suicidal ideations. Even when asked, he would say, I'm not going to talk about that. And he went on to say that he had withdrawn all his money from the bank, that he was going to throw one last big fling. And when asked if he could make some sort of agreement with me as to coming in to see me the next day and not to do anything that would be self-destructive, he said that no, he could not make me any statements like that because he would not lie to me. Now, this is how he was presenting at that time. He was obviously appearing very depressed. He was semi-agitated, but when I asked, in obvious light of the fact that he was communicating to me that he had planned a suicide attempt, I came out and asked him the meaning of his coming to my session and to help me understand, what he was there for. And he told me that he felt that he wanted at least one person to understand. And then he went on to, and then I said, well, Joe, JL, I don't feel real comfortable in letting you go home in this condition. I'd like you to stay in the hospital. He just happened to be seeing me at the hospital this time. And he said, there's nothing you can do to stop me. There's no way you can keep me from staying. And I say, well, I would like you to make the decision to stay because obviously, you're in an agitated and upset state, and I'd like you to, give yourself some time to get through that. And he says, no, I know better. If I come into the hospital, I'll get over this and I'll feel better until the next time, and then I'll be back in the same place again. So I, at that point, stood up, got in front of him, between him and the door, and said, Joe, I'd like you to go back into the hospital and admit yourself, and you have a choice. You can do it. You can walk back on your own, or I can call for staff and we'll take you back. At which point he went back by himself, and he was signed in on a 3-day hold, which is an involuntary hold. and in 2 days he was released because he felt better in 2 days. The question, I bring up this issue because I think it's a big issue, is I did spend a lot of time talking to him. This session probably went on an hour and a half. And I did try to understand, to allow myself to be as in a beneficial place as possible, to allow light to shed. And when I got to the point where I saw that his mind was fixed, that he was going to kill himself, I felt a little bit trapped. I felt that I knew that legally I could not let him leave the hospital, and that I had to insist that he stay. It worked out that he did it cooperatively, so that was certainly a benefit, because it could have escalated into a physical power struggle, which does happen in hospitals with patients who want to kill themselves sometimes with hospital staff. At the point where I felt convinced that he was serious, that he was going to kill himself, I felt that I did not have any metapsychiatric tools to fall back on, and that I just had to, at that point, protect him from hurting himself, at which point I insisted that he stay in the hospital. So my first question would be is, how does one separate metapsychiatric principles from medical legal responsibilities?
You see, this is a very good illustration of the madness which pervades our society. For instance, society doesn't know the difference between healing work and police work. Here is a physician who is studying for years and years to be a healer, and society is ascribing him police work functions. And he is responsible to stand in the doorway and control this power-mad patient with the power madness of society. So we see here power madness and control. It's the same thing. Now there is, when working with the so-called suicidal patients, one thing is very clear. How the power madness of a patient manifests itself in a subtle way of inducing a sense of powerlessness in the therapist. Now, whenever we are placed into a position of powerlessness, we are provoked into becoming power mad. And we are countering personal power with personal power. Now, how can that be helpful? That will accomplish nothing. What usually happens, if we succeed in overpowering a power-mad patient, he will make exceptional efforts in the future to increase his own power, to overpower the physician, the police department, the fire department, the administration of the hospital. And what results? The condition gets increasingly worse and worse, because what he sees is that he needs more power. Otherwise, he will be overpowered. So there arises a condition of increasing delusional preoccupation with exerting power against society, against the doctors, against the police, and fantasies of megalomania can develop. And when the patient sees that he cannot cope with these power-mad institutions which surround him. He said, well, I have one way of coping with it. I'll kill myself. And then they'll be sorry. And they see that they have no power over me. So, in trying to help people on their terms, everything becomes worse and worse. If you succeed in hospitalizing this patient today, 2 days later, 2 weeks later, 6 months later, a year later, he is released in a worse condition than ever before and more fanatically committed to power madness. So what good is it? What are we accomplishing? Nothing, because we don't understand the meaning of the patient's problems. Now, a metapsychiatric therapist will understand that this individual is suffering from a tragic ignorance of the fact that man doesn't have personal power. Even if he has a uniform of a policeman or a white coat on, there is no power. God is the only power. And the way to cope with life is not by coping, but by yielding to the love of God. And the task of the therapist is to understand the meaning of the patient's problem and shedding light and bringing the patient to a realization that in order to survive in life and prosper, it is not power that we need, but understanding of our absolute oneness and contingency of divine love intelligence. We do not allow the patient to drive us crazy. Yes.
And neither do we resist allowing them to drive us crazy.
If you resist, then you are
You're just as much
right, right. So we meet the response, the metapsychiatric response introduces an entirely different level of seeing and understanding. We open up to the patient a new world, the world of love intelligence, where the issue of power doesn't exist because it belongs to God. Yes?
You said that the issue is not yielding, or no, the issue is not coping, but rather
Yielding.
to love intelligence.
Right.
Could you expand on that a little bit?
Well, of course, words alone will not do it. For instance, you could have read some of the literature and know that it is love intelligence which has the power to heal, and we have to yield to it and receive it in gratitude. But if the therapist has been redeemed of his own ideas of personal power, madness, he will be able to communicate this to the particular patient in a more meaningful way than if it is just repeating certain phrases, love intelligence, like that. So therefore, the training of the metapsychiatric therapist is very important, which moves in the direction of qualifying him to communicate spiritual truths in a meaningful way rather than just an intellectual way. Charles, you wanted to ask something?
Yes. When state regulations
mandate certain guidelines and precautions and behaviors as they do in the setting in which Dr. Lambertson works, is it possible to function as a metapsychiatric therapist?
Absolutely. You see, the metapsychiatric qualification transcends all this and makes them unnecessary. Sexual activity. I hope that Dr. Lambertson will soon reach a point where he won't have to stand in the doorway. He will be able to communicate to the patient and clarify the meaning of his behavior. See, right from the start, this patient's aim was of rendering the doctor powerless and having to resort to the institutional regulation, throwing the book on him because he couldn't cope with the patient. But that's not therapy, that is called managing or controlling. Yes?
Wait a minute.
Yes, yeah, yes.
When Larry was giving his presentation, I wrote down the question, what happens if I can't learn fast enough, or is God slow? I remember that chapter some. And as he spoke a little further about getting into the doorway and was talking about the necessity because of the legal requirements to protect the client from hurting himself, he was also implying that in some way, because of those same laws, he was needing to protect the therapist because of the fear of perhaps I can't learn fast enough. Okay, how in my thinking may I address the block that perhaps the patient isn't ready to hear?
So let's start with your first question, right? Could you repeat it?
I wrote down, what happens if I can't learn fast enough?
Fast enough, or if God's slow?
Is God slow?
Now, we ask, what is the meaning of this concern? Yes, sir?
It's the idea that I must be fast enough to do something. It's dual operation.
And very personal. Right. False sense of personal responsibility, which is called self-confirmatory ideas. Okay. Well, then you quickly hurry up to Orange County and take some more training.
It isn't God that's slow, it's me.
Yes.
Dr. Hora,
Wait a second.
Wait a second. We want to record your voice for posterity.
All right. It seems that either controlling or coping or resisting are all personal things that we think we can do. So is my understanding then of yielding meaning to set aside any sense of the personal? Is that what-
Absolutely, sure.
Okay.
Not only set aside is good, very good, but losing it altogether,
Would be yielding.
it's even better.
Okay. Thank you.
It just struck me, Dr. Hora's comment about that what the patient needs to learn is to yield to love. If the therapist has to, that's exactly the healing of the therapeutic situation too, is to know that there's no solution there except yielding to omniactive love intelligence.
Dr. Hora, I've worked in hospital settings where I've dealt with very sick and dying patients, and the issues are somewhat the same. My question deals with the difference that society places on the death of someone who is, dies a tragic medical illness, and someone that dies of suicide. There's tremendous negative religious connotations for someone who takes their death at their own hands, and some people feel that when they are thinking of it as a way out, don't want to do it because they fear that somehow on the other side there are terrible consequences toward it. The question is, what is the difference between death by suicide and death, metapsychiatrically speaking? Could we just deal with the issue of death itself?
Not much. And I'm not saying it frivolously. We are all sooner or later destroying ourselves due to ignorance. And the more we understand life in the context of God, the less destructive we are towards others and towards ourselves. The main problem is self-confirmatory ideation. That's how we are destroying ourselves throughout life. And if we learn to let go of that, then longevity can result from it, and more harmonious prospering in life can result from being willing to let go of all self-confirmatory ideation. And there's a million ways that people do indulge in self-confirmatory. You don't have to do, and you just have to think that way. And you're killing yourself, literally destroying yourself.
Dr. Hora, earlier you stated that our country gets confused between police functions and healing functions. And in the work that I do, I feel that's very true in treatment that's court-ordered of sex offenders.
That's an absolutely ridiculous idea. That's completely insane.
Yes.
You cannot force people to become healthy. It's ridiculous. Yeah.
Yes. There are some people that would not be, and so my question relates to in dealing within our own mandates. What if we're face to face in a situation where the client is not really interested in being healed? He's not interested in seeing another context. Then we find ourselves, would we not, more in the role of the police officer, not a metapsychiatric healer, in which then we may be forced to figuratively stand in that doorway?
Only if you are mad. If you are a healer, you respect people's right to be sick. You even respect people's right to kill themselves. You have a right, respect people's right to be ignorant, as long as they do not trespass on you. You see, we cannot coerce people to become healthy. We are available. We cannot afford to want anything, and we cannot afford to not want anything. We are here for God. We are available. But that's all.
The building is smaller than the back there.
Here I am. I have two questions. One about what appears to be. I wonder if you can make a distinction between being seduced and hypnotized.
But
You may need to elaborate a little.
no, it's all right. Seduction is a method of inducing hypnotism. You can hypnotize people three ways: through seduction, through provocation, and through intimidation.
Thank you. The other question was about right seeing. And it occurs to me that right seeing includes seeing the other person at a learning place.
Well, as you know, seeing is also used synonymously with understanding. And when we understand the meaning of an individual's mode of being in the world, and when we understand what is the existentially valid mode of being in the world, then we are able to manifest right seeing. I think Laura wants to ask a question here on.
And then Joanne. Already raised before the break,
Yes.
I cursed her off, but don't forget Joanne.
In talking about a person having a right to kill themselves, I'd like both the medical doctor and you, Dr. Hora, to address the difference between a suicide from a psychotic, schizophrenic position and from a more human position.
They both end up in debt. I'm sorry, little privilege. When the person, excuse me.
Yeah.
When a person comes into me and communicates the intent to kill themselves, I don't draw a distinction whether that's to me, a person's a little crazy anyway if they're in that position. I mean, sometimes it may be a schizophrenic type of thing with a voice inside that's a hallucination that's telling them they should kill you or they should kill themselves. And other times it's because they're usually expressing tremendous emotional pain and they just can't bear the pain anymore and they see it as a way out. Again, legally, there's no distinction between the two. If a person's suicidal, you have a legal responsibility. This gets me back to the issue, and I'll let Dr. Hora address this as well as yours. And that is, at the point a person comes to me and says they're suicidal and I believe them, if I don't do anything about it, they are trespassing on me because the law says that I am responsible for them at that point. That I am legally responsible for someone who comes to me and communicates suicidal ideation and then leaves my office. So I'll pass it now to Dr. Hora.
I'm not sure that the legal issue is that clear-cut. Now, you have a certain amount of intervention is expected of you by society. Well, it's not. Yeah, how about your reputation can be threatened by a patient who is going to commit suicide? Perhaps he will climb up on a ledge and broadcast to the whole community, I have been a patient of Dr. Lambert's. He didn't save me. It's his fault that I'm now gonna jump. And the crowd below said, jump.
And then there's just me going, don't jump.
The fact is that we are very intimidated by these people because they want to intimidate us. They want us to experience powerlessness and fear and absolute despair over our impotency. But if you are already powerless, how can anybody render you powerless? Of course, doctors are loath to admit that they are powerless. We have a tradition of omnipotence in the medical profession.
Did you want to talk about the issue of psychotic versus non-psychotic suicide?
No, it really makes no difference. It's the same, it's just quantitative. A psychotic is more power mad than a neurotic. Always, the issue is a power struggle, either against the helper or against society, or against a particular individual. Just seeing life in the context of power struggle. Okay, let's give a chance to Lori.
Getting back to the issue of responsibility, personal responsibility, you said that essentially all types of deaths are the same. And it seems if we observe someone drowning, we're going to jump in and save him, even though that death has meaning to that person. If we understand that it's not operational, we're not impressed by it as a healing, I guess I feel like that's a response also to stand in the doorway of someone that's, going to destroy themselves. We understand it's operational, but it seems to be responsive at that particular moment if we know nothing else.
Alluded about power and control and self-assertion and ego strength and operationalism, then we are not really being helpful. We are just compounding the problems, whether it's the issue of suicide or anything else. Trained in the operational approach to all problems, mental, emotional, or physical. So very strange, and it may sound like we are passive and quietistic and do nothing and helpless. But in fact, we are able to bring to bear the only power intellectually. And if we are inclined to be scared, we will react. And then, of course, when we react, then we immediately place ourselves on the same level of thought as the particular individual who is inducing that reaction within us. But if we respond, then we remain on a higher level of understanding, and that is more effective. The vast majority of people just react. And then we have this, a collision of similar attitudes. If you are a well-trained metapsychiatric worker, then you respond, which is like this. You transcend, and your response is helpful rather than helping.
So would there be a difference then in terms of the response to that situation would be standing aside, whereas a response to someone in great imminent physical danger, is that still responding? It's just a different...
Laura, you're trying to imagine how it would look like if somebody reacts, but you cannot imagine it because it is in every moment different. So we would like to visualize how a responsive individual would deal with that situation, or how a reactive individual would deal. You can imagine the reactive one, but you cannot imagine the responsive.
I'd like to take a moment just to clarify that it seems, Dr. Hora, that you are saying that if the consciousness of the counselor is actually free of the power issue, if the counselor knows him or herself to be powerless and therefore cannot be engaged on the issue of power, then something happens in the consciousness of the patient. Has nothing to do with any physical move, anything, but something, it changes the mental, the consciousness in that dialogue of those two people. A change takes place. Is that?
Not only in the mind of the patient, but in the mental climate of the whole situation.
The whole situation.
The whole situation is a different mental climate. We can see it very interestingly when you compare group therapy sessions between certain therapists. Usually in the metapsychiatric groups, there is no conflict between the participants. Never. There is issue-orientedness. There is harmony and peace and wisdom and continuous clarifications of issues. Now, then there are counter groups and this kind where people are at each other all the time, interacting either positively or negatively, but mostly negatively. It is very exciting and belligerent and sometimes frightening. There's a lot of interaction. In a metapsychiatric group situation, there is absolutely no interaction. There is just a joint participation in the process of clarifying issues which keep coming up spontaneously.
Some of you who are in the class may remember that I think in perhaps the first class we mentioned a story of a woman who had been extremely emotionally upset over something her therapist said. And on the way leaving the session, her mind was filled with fantasies of that she couldn't work, or she might even end up in the hospital because it was so upsetting what he had said. And when the thought popped into consciousness that no matter what she did, it wouldn't make any difference to the therapist, the whole disturbance simply fell away. And it was revealed to this woman in that moment that emotional disturbance is manipulative in its intent. And if it's clearly not going to get anywhere, it just disappears. Yeah, Fern.
There was a time I was called by a friend, and Laura's description came to mind when she was asking the question. She was suicidal and had been a very well-functioning at a high level of administration in the city. And we had known her because she lived with us with her little boy when she was a student. And she was very suicidal, and the more she talked, the more powerless I felt. And I didn't know that I was feeling powerless. But she hung up, and she said, "I'll call you later." And I had a chance to study the tape on depression because I could see she was very, very depressed and morose. So I listened to the tape on depression, and the word power madness jumped out at me at that time. And I realized that I felt powerless also, and that I was in the same boat as she was.
Right.
So when she called back, she went on and on how she was going to do it and whatever. It seemed a ridiculous way. She was going to starve herself in the park. And I knew her. I knew she was a nutritionist. She was going to remove her. So it occurred to me, since the issue of power madness was now clear and I knew there was nothing I could do, I was somewhat freed. And I had a humorous response. How ironic for a nutritionist to starve herself in the park. She was able to laugh. And then she said to me, "Will you take care of my son?" And I said, "No." I said, "Your son has a father." She said, "Oh my God, that's right." And then she said, "Oh my God, that's another concern because when I do it, I'll know he's with." And I said, another response came which was very humorous, and I had the courage to say it rather than be serious. And I said, "You know, with your luck, after you don't have anybody, you'll have to stay around and watch what he's going through." And it was like she never called back about that suicide, and she never did go through with it. And it was very serious because she was having delusions and whatever. And she eventually went for help elsewhere, not to me. And it was over. But that response, I would never have thought of that beforehand or imagined it.
It helps a great deal to know that nothing is more ridiculous than seriousness.
Thanks. When you were talking about reaction too, a thought occurred to me, Dr. Hora, that especially I think in light of something that you wrote, I guess, in the existential metapsychiatry book, regarding reactions and responsiveness, and how reactivity is almost another self-preservation attempt, just to hang in there in some way. Now, but the question that I have is regarding the reactions, I guess, of all the people who are just madly scurrying about with this, what's her name, Bouvier, is that her name? The lady, and are you familiar with that situation? I guess there's a woman in Riverside or someplace here in California who suffers from CP, and she is unable to take care of herself in any way. And she is insisting that she be allowed to die. And they have gone to court and they have fought, and her husband was begging her to come home and live with him, and there's just all these frantic attempts and she wanted them to allow her to starve in the hospital, and she refused food, and they were feeding her with an IV. I haven't kept up with it. But what could you shed a little light on clearly there's this whole power thing going on, but there's this, what is the dramatic reaction or self-preservation attempt by the people around her, the society, in her willfulness to be allowed to do this?
Well, it sounds like the same story we were talking about until now. Power begets power, and power corrupts, and absolute power corrupts absolutely, and it's a mad, mad, mad world out there. And while it looks very tragic and sad, but that is really not the issue.
I wondered if maybe Larry, do you have another case that you'd like Dr. Hora's comments on, or any other questions that you might have out of your preparation?
Well, we seem to be covering a lot of the areas. I think one of the issues that, of course, is with me is I have had the experience, talking about this did bring to mind a 40-year-old gentleman who came into my office with very depressed affect. He was down. He was feeling that he was one of the worst fathers in the world. He'd had ongoing sexual relationships with a daughter through her adolescence. He continued to feel very close, had frequent contact with her, had done very well as far as business goes, had gone through a divorce and still in the process when he came to my office. And he came in with, his reason for coming was to talk to someone and get his, to show people that he had made an attempt and was getting his things together. And it was clear that he was also talking about ending his life and wanted people to know that he had made an attempt, had gone to see a psychiatrist, and was trying to get everything in order before he went out the door. And
he came to tell you that.
Right, he came to tell me that.
Why pick on this poor fellow?
In this particular case, I wasn't impressed. And the guy went through a healing. He went home and he slept for 36 hours, and he came back and he was a different man, and he's been bright and happy since then. And before he left, he looked at me and said, "You must see me different than I see myself." Mm. And he walked out the door. He was extremely depressed when he walked out the door. He made some statement about, "Boy, I feel worse now." He walked out the door, went home, and he slept for those 36 hours and hasn't been the same since. He came back and he said, "I'm a different man, and you didn't do anything."
That's the best compliment you could get.
I said, "Yes, I know." Then, this was shortly before JL came to me.
This was TH.
And as I sit in a hypnotized, self-confirmatory state with someone who isn't seeing any light, I wonder where it went, and and I knew when I was feeling the power struggle, and I knew when I was feeling the control issues, and I knew when I had to get in front of the door to keep him from leaving, that it had went. It was gone. I mean, I wasn't in a beneficial state. I wasn't experiencing PAGL. I knew that. And I suppose the question is that as we are traveling this path to knowing greater truth, as we struggle riding the firmament, as we fall below it from time to time, we have to rely, I think, on just the tools of the operational world, and then work harder in getting ourselves back across that firmament. I don't know any other way. And I wish it did. I mean, I wish it touched me.
How does a toddler learn to walk?
By falling.
By keep falling, yes.
Ken?
One of the thoughts that occurred to me is everybody's been talking about reacting and responding. And would this be accurate, Dr. Hora, that a reaction, its source is always in phenomena, and a response, its source is always in God? And so if we're ever in the process where we're feeling or knowing that the things that are occurring in us are coming as a result of this other individual sitting here, or our family, or all these things, we can know that we're reacting, where when there's PAGL, we can know that it's coming from God.
That's right. That's correct. Very well put. Beautiful. Yes.
Thank you. What the issue was interested in my mind that was coming up was when Dr. Hora said the word trespass. And it really has a lot to do with operationalism, the word trespass. And a beautiful example that I'm aware of here in San Diego of that, how that worked, with a teacher. And the teacher was teaching in a rough neighborhood. And in school one day, one of the large, black, thin teenage boys stabbed her in the neck with a knife. She didn't react to that. She came from PAGL, which means that what she expressed was her love. She turned to the boy and said, in a way that he got it, that she loved him. He just dropped the knife and cried in tears and asked for forgiveness. And I thought that was a beautiful illustration of not reacting.
Well, of course, if it really happened the way you described, it would have been a Christly way of responding. But then we can also ask the question, what was it in her consciousness that attracted this experience? Yes? So we don't know this.
This attracting, and then talking about attracting, and then something that Dr. Hora, you said earlier about taking anything seriously is the most ridiculous thing. I understand was Monday when I wasn't in the group. You were talking about the PAGL groups, and when I first started my group, I took it very seriously, and I really wanted to teach these people something. And it was a very valuable lesson that Jan helped me to see, because I got a letter. Well, actually, I didn't, but I hold the group in a church, and a letter was sent to the minister of the church by one of the women in the group, and she wanted the minister, did she know these horrible things that I was trying to impress upon these people? And she totally misinterpreted one particular issue, which I don't recall. But it was very valuable for me to see that I was taking it all very seriously, and I really was trying to impose on them. And so, and then when, Larry said that you have to fall in order to learn to walk. So
I'm learning slowly. What constitutes a trespass?
Influencing persons. If we have the intention to influence somebody, that's a trespass. Yes?
As a follow-up to the what was in the consciousness of the teacher that you attracted the experience, the same question can be asked of Christ, then what was in his consciousness that he attracted the experience of crucifixion?
Well, of course, that's a matter of conjecture and theological interpretation. And we don't want to go into that now, right? It would take us about 2 weeks to clarify, to argue with us full. But of course, it wouldn't make sense to see the crucifixion as a tragedy or a failure of any kind. It must have some other meaning, which we won't go into right now. If you were in the, you were not at our
Conference.
meeting, at the conference, we somehow touched upon it a little.
Okay. I'd like to bring up another question or another issue, actually, or pay attention to that. Maybe you may make a comment on that effect. Somewhere along the discussion, you mentioned that the metapsychiatric therapist has the possibility, with the tools that we have of the two intelligent questions, discerning the meaning of the symptom, the suicidal symptom, or any other symptom, to open up to the patient a new world. And with the second intelligent question, asking what really is, we can open up the possibility of living in the realm of love intelligence. But as we are discussing here, I see that for all of us sitting here and most of the professional people who are working with patients and sometimes in crisis situations, that the metapsychiatry approach opens also to all the counselors and the professional mental health workers and psychotherapists a new world.
Definitely.
And we don't have to work in this dreadful world, and we are not required to do police work. And maybe we are involved in that right now, but metapsychiatry opens to all of us the possibility to have a beautiful, harmonious, and lovely unfolding practice in which there are no burdens and which there are no, at least the crisis can be diminished to a great extent, providing only one thing, and that is really what the crucial point is of Anne's training program in the School of Extensive Metapsychiatry, providing one thing, that we shift our identity as therapists. As Dr. Hora clarified to me this week, is that we are actually not therapists. We are teachers. And we are teachers of truth. And once we see that we are teachers of truth, a whole new thing will happen to our practice, no matter whether we are working in a mental hospital or in an outpatient clinic. As teachers of truth, we will see something entirely different happen to our career. We will be taken out of working and addressing diseases. We will learn to discern meanings of people's modes of being in the world and help to clarify these modes of being in the world. And gradually we will find that people that come to seek us out are not seeking us out because they think we can help them with a crisis, but they come to seek us out because they see that we may be able to help them to find truth, and they will be interested in truth. They will not be interested in manipulation, but in truth. And so the metapsychiatric training program and therapy approach opens up the world for the counselor to become a teacher of truth and to be sought out by people, by individuals that are receptive and interested and searching for truth. And that's a whole different ballgame.
That's a wonderful note to end on.
Okay, before we enter, I have one more, just an announcement. We have luncheon set up in this room by the hotel. Will take them about 20-25 minutes. There's a beautiful patio out there where we can talk together. And but before you leave, I would like to introduce to you, in the back, standing, leaning against the pillar, is our pillar, Beverly. And she's available to you if you have any questions about the training program that for professionals. She can give you the information on that. Also, if you have not yet registered, please do that with Beverly, and she also has literature available if you are interested in literature on metapsychiatry. Are there any questions about any organizational matters here before we have lunch? No, then I hope to see you all at the lunch table in a few minutes. And I'm Dr. Hora for working with us this morning. And Larry.